Hi everyone, Dr. Sylvestre here. One of the things that I really dislike is having one of my patients wake up from anesthesia just howling and totally unconsolable. If you're like me and you don't like to hear that, you might want to listen to this chat I've had with Dr. Nancy Brock. Dr. Brock is a board certified anesthesiologist, and patients waking up poorly is one of her pet peeves. Have a listen.
So I have heard you say, I believe that anesthesia starts at home in the sense that patients should come into the hospital in a calm state. That's right.
What about post-operatively? A relaxed patient coming into anesthesia, do they also recuperate better, or do you usually manage to get, I'm going to say, control of their anxious state during anesthesia, and therefore they are going to wake up the same way? Does that?
I think there's quite a bit of variability out there, but I'll just describe how I read the situation in order to decide when I'm getting towards the end of a procedure. My question to myself is my patient going to wake up quietly and not make a lot of noise at extubation? And the sense that if your patient goes under anesthesia in an agitated state, the risk of the patient waking up in that agitated state is actually quite high. But also, while the patient is under anesthesia, and I'm sure everyone's, where you have a patient that's just really rock steady all the way through the anesthesia in a lovely way. And you're getting towards the end of the procedure and you just have stable vitals throughout the procedure. So you know, whatever your approach to pain control was, it's working. I think that patient, you can probably not 100% predict, but pretty much predict that the patient at extubation is going to be quiet. There's nothing worse, in my opinion, than a patient that vocalizes on recovery. And, you know, there's this Murphy's Law that if there are clients around, when you extubate the patient will scream. And how can you possibly explain to your clients that, oh, it's okay, he's just waking up from anesthesia? It's hard to do.
No, and you know what? It's hard on everybody in
It
the
is.
hospital. I mean, we have two ORs and four tables in our, sorry, three ORs and five tables in our hospital. And just hearing a patient wake up, I might be doing whatever I'm doing, but hearing a patient just all of a sudden wailing, and it's unmistakable. You know, wow, they just woke up from anesthesia. You know, was it
Mhm.
another
Yeah.
surgery? Was it an ophtho? Was it a dental procedure? I don't know, but they're waking up from anesthesia, and that's just hard to hear. It's
It
hard.
is. And as we get older, as I get older, I find that I have less and less tolerance for that kind of noise. And it is avoidable. I guess that's really what this conversation is all about, that these frustrating, annoying aspects of anesthesia care and anesthesia management are avoidable. And the solution to these problems is not complicated.
And
It just requires a little planning.
And I'm really glad to hear that. I recall during my mobile practice days, you know, we'd go to different hospitals, and the hospital would manage the, you know, the anesthesia. And man, oh man, you know, the patient would wake up screaming, and I would go, "Can we give him something?" You know, and
Yes.
you go, "No, no, he's just waking up," you know, and I would just yeah, it's awful. And of course, the patient would eventually quieten down and be fine, but that first 5, 10, 20 minutes aren't necessary. And I'm glad to hear that. It's, as you say, good planning, right?
Well, I'm glad you mentioned the 5, 10, 15, 20 minutes because I will, to some extent, tolerate 5 minutes, but I'll set my watch. And if in 5 minutes my patient is not showing visible signs of calming down, if I haven't intervened with drugs, I will intervene with drugs.
Good for you. For you. I had a procedure about a year ago, a gastroscopy, and I remember waking up from my relatively short anesthetic, screaming I was in so much pain because there was still so much gas in my intestinal tract. And I'm in a haze. I had propofol, so the wake up was pretty quick. But I'm aware that I'm screaming and saying really bad words. I'm aware that there's other patients waking up next to me and they're all quiet, but I'm going, I feel like I'm like just a bad cat or a bad dog waking up from anesthesia badly. And then, the doctor came and he said, it's okay. It's only, gas still in your intestinal tract. And all I could think of, I don't care what it is. It hurts. Make it stop. And sure enough, within a minute, the doctor had my hand and he injected something on my IV catheter and I was happy again. And then I was fine, but I've experienced that bad wake up from anesthesia and not worth it. Just not worth it. Yeah.